More rescue ships have arrived in Libya's western port of Benghazi. Doctors there are rushing to treat the wounded. It comes as rebels say they are fast running out of money and fears are growing of another humanitarian crisis. Doctors at Benghazi's main hospital say they are terribly short on supplies. Natalie Carney has this report.
The commotion of a busy Benghazi hospital emergency room. The latest victims of the intense fighting in Misrata. They arrived in Benghazi by the boat that took 5 days to dock, then a grueling 24-hour journey, delayed again as Gaddafi forces shelled the port city as they fled, killing several. Ibrahim Youseff Shabani is happy to be alive. The 22-year-old engineering student from Misrata lost 4 of his friends and his leg when they were hit. We were loading weapons into my car to bring to anti-Gaddafi forces on the front line when a missile blew up next to us, he tells us. Abdul Qasim survived the blast that killed 2 journalists last week, yet says, as soon as I am better, I will return to the front line in Misrata. Doctors and nurses work quickly to treat the senseless injuries of war.
This patient come from Misrata, gunshot in the chest and the fracture in the right lower limb.
5-year-old Aisha looks on. She too is a victim of the offensive, but in a different way. As the war rages outside, her cancer rages inside and has gone untreated.
Daily, more and more patients are arriving from Misrata and other frontline cities, filling up beds, filling up rooms in hospitals all across Benghazi. Increasingly, doctors are becoming more and more concerned that there soon will be a lack of space and a lack of medicine.
Not enough bed in this hospital and need the medicine and the drug. The number of the doctors and the help is not the same of the patient from Gaddafi, from Misrata.
Aisha has cancer in her right eye. Her uncle brought her on board the ship from their hometown of Misrata, desperately seeking the help she needs to keep her cancer at bay. She used to get chemotherapy in Tripoli before the uprising, but now the trip is too dangerous. She's not received treatment for 2 months. Her situation is deteriorating day by day, he admits. She is in a lot of pain. Aisha's cancer has returned twice, and her doctor tells us she has only months to live. Not even her favorite toys can make her smile anymore. Her uncle is happy she will start therapy again in Benghazi. These patients are lucky to have escaped the worst of the violence. But for Aisha, her battle is an internal struggle that has little to do with this war, but it has been made all the more desperate because of it. Natalie Carney for CCTV in Benghazi, Libya.